All right, folks, so we've got a bit of a discussion ahead of us here today. I'm going to bring you information and articles and research. You can TWD on Facebook comments only. This does not work with YouTube. It doesn't work with Instagram either. Comments on Facebook alone, if you type in TWD, you'll get a link to the website page, thewilddoc.com. There, I will have my staff, as soon as this is over, as quickly as possible, she'll be uploading the references that I discussed today. So I'm going to try and give you an unbiased perspective of this and just a review of the information that's available to us that ultimately should drive a discussion about whether people should be wearing masks on a population-based scale. Bringing additional information and discussion briefly about ways in which we could actually reduce overall mortality from infectious diseases if we were to implement strategies in science that's already available to us. And one of the biggest points I want to make here in frustrations that I have is that we are implementing something that doesn't have science to back its use in this grand scheme of things when it comes to a population of masking everybody, of masking uninfected, healthy individuals, and people who aren't working in contact with those who are infected. Of course, there's the argument that what if during the phase, an infection phase, before you become symptomatic, could you spread that virus? And there is some evidence to potentially say that that person or a person who is infected but non-symptomatic could spread the virus. Again, that is through cases alone. And there's other cases where people came in contact with hundreds of individuals. They were asymptomatic, but they never spread the virus. So my biggest issue is the non-disclosure of effective means to prevent coronavirus severe infection and death rate. And then also the non-disclosure and discussion about ways in which we could be protecting the most vulnerable from infections effectively. But instead, we are paying more attention to and we're putting more emphasis on something that doesn't have evidence at a population-based setting. So I title this Masks, Medicines, Talismans, like amulets. Talismans, again, are things that are supposed to hold magical powers. And I talked and did more of a comical routine yesterday on that. So if you want comedy and joking, things like that, watch last night's video I did myself. So New England Journal of Medicine, universal masks in hospitals in a COVID-19 era. So they state right away, we know that wearing a mask outside healthcare facilities, and that's the key, outside healthcare facilities, all right? And that's outside healthcare facilities in terms of those healthcare personnel working directly with infected individuals, all right? So there are studies, and I will put this out there right away, and we'll go through a couple of these studies, all right? There are more studies than available. There is a synopsis and a review, a meta-analysis of all the studies that they could currently find on SARS coronavirus 1 in the past Hong Kong, Singapore, the SARS coronavirus 1 outbreak in around 2003. So that wearing PPE, protective equipment, personal protective equipment, for those nurses and doctors working directly with infected patients. They didn't put the mask on the infected individual. They wore protective gowns, gloves, masks. They had more efficient masks, and they used them as disposable. They didn't reuse them, they were disposable, and that's one of the biggest key things. So if we had a discussion in all honesty, we have to say that the way we're using masks in the general population, and I'll show you the science, I'll show you the study, could actually be increasing the risk of infection because we are not using disposable masks, which, like any filter, if it efficiently and effectively filters and collects a pathogenic organism, whether it be bacteria or viruses, if you keep that on your face and you keep applying it to your face over and over and over again, you keep touching it, you keep setting it down, you keep using it and hanging it in your car, you are in essence increasing your risk of contracting an infection that mask would have prevented you from contracting had you taken it off properly, disposed of it, washed your hands and cleansed your body, and then picked your nose. All right? You would have been protected. But the way here's my issue, the lack of communication of proper use of the mask, to me is probably the biggest issue I have going on right now. All right? So we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. So outside the public, wearing masks offers little, if any, and there's no evidence to prove that. Here's what they say. It is also clear that masks serve symbolic roles. I am not going to use something that is merely symbolic, though. That's me personally. Masks are not only tools for healthcare workers, but they are also talismans. Talismans are an amulet. It's something that's supposed to hold magical powers that may help increase healthcare workers' perceived sense of safety. So it increases their perceived sense of safety, but if it doesn't truly increase an individual's true safety, then I am not going to wear a mask and give somebody a false sense of security, because that would be deceiving. All right? Giving somebody a false sense of security is still deception in my book, okay? You guys have the freedom, and I hope we remain a free nation, all right? You all have the freedom to wear a mask if you'd like, but I think forcing people to wear a mask should not be happening right now on a government-wide scale. Now, if somebody has a business and so selects to want everybody in that business, all patrons, all people walking in, to take their temperature and use a mask, well, if they run that facility, then that's their choice. Let them have freedom. Don't hate on them. But I would love to have the opportunity to help them realize other measures in which they could reduce their staff's risk of infection, their overall health. You know, something just popped in my mind that I was talking to a patient today. You want to know why we're seeing increased rates of pneumonia and influenza deaths and now coronavirus deaths and all these things? Is because we've had skyrocketing rates in the U.S. and much of the world in chronic respiratory illness rates. So chronic illness, severe inflammatory conditions that are affecting the lungs of people in this nation are going up. And they've been going up. So more chronic individuals or more chronic disease, especially affecting the lungs, is going to create a higher and higher susceptible population, a population that has higher and higher rates of susceptibility to a infection, whether it be the common cold, coronaviruses, rhinoviruses, or any others, or influenza. We are going to see more people die from those infectious diseases because those infectious diseases are nothing more than opportunistic pathogens that when somebody is susceptible, yes, they could be the straw that breaks the camel's back. So why aren't we increasing people's response capability to being able to ward off or efficiently fight off a virus? We're not monitoring we're not testing people's capability of resisting severe infection when they come in contact and mounting a proper immunological response. That's what the Wellness Way doctors, that's what people like myself are trying to advocate for. Why aren't we testing deficiencies in nursing homes, the deficiencies that are found to increase the susceptibility of severe illness and fatal outcomes from all infectious diseases, whether it be SARS coronavirus, coronavirus regulars, rhinovirus, which is more prevalent in pneumonia cases in hospitals, which again I talked in a prior video that rhinovirus causes more pneumonia cases or is associated with more pneumonia cases in hospital settings than influenza is. And they can cause the exact same appearance as SARS coronavirus infection and pneumonia. And those are assumed cases of coronavirus now, but they're actually rhinovirus cases. But we're not testing for rhinovirus right now. We're not differentiating whether somebody has a rhinovirus or a coronavirus. It seems like they don't care. They want all the assumed cases to be counted towards coronavirus cases and deaths so that they don't end up looking like they made mistakes on their models that obviously were massive mistakes given the number of people that have actually contracted the illness and died from the illness. So I will not participate in their magical things, all right? Again, their perceived work, well-being and trust in the hospitals, but again, that's falsely perceived protection. Although such reactions may not be statistically logical, we are all subject to fear and anxiety, especially the times of crisis. One might argue that fear and anxiety, and remember that, fear and anxiety. And then I'm going to show you another study, A Tale of Two Cities, Singapore versus Hong Kong, and you'll see the rates of infection and the mortality rates were higher in the nation, in Hong Kong, where fear and anxiety was higher. And the use of masks was higher in Hong Kong, where again, mortality rate was higher, all right? So take that into consideration. Make a free nation's choice, whether you want to or not. Marginally beneficial masks, again, they said they were not effective except for in healthcare settings. And again, that is true for SARS coronavirus 1 at least, particularly in light of the worldwide mask shortage, but difficult for clinicians to hear this message in the heat of the current crisis. So again, clinicians in the current crisis, because of fear and anxiety, don't want to talk about other measures, or they're just not educated on other measures. Again, I'll give you 2 links. I think this is a great read. What does God say about people who use amulets? And an amulet, like a talisman, is a charm to avert evil and bring good fortune. And they literally say masks are basically talismans. All right? I thought it was a good read, so I throw it out there for you if you want to read something biblically about the use of charms, amulets, talismans, idols, to feel like you're protective, for perceived protection. All right, this is a good write-up, and I'll get you the link to this. Masks don't work, a review of science relevant to COVID-19 social policy. Now, there are several different research studies, the majority of them that I'm going to go through. All of them I think I'm going to go through in this video that he went through. But if you want a source with it clear and concise and quickly available, that's a great reference. Again, I'm giving you references for more about you to read, and I'm going to go through a few. Transmission of COVID-19 or 2019 coronavirus infection from asymptomatic contact in Germany. So asymptomatic transmission has been somewhat documented, all right? So it's a case. New coronavirus may spread as an airborne aerosol like SARS. Okay, so the novel coronavirus, SARS-2, can survive in the air for several hours and find particulate known as aerosols, which lingers in the air for longer periods of time, unlike droplets. All right, droplets, which are basically spit out, land on material and stay there, and then that virus can survive, and then you'd have to touch it and bring it to your mucosal membranes to infect yourself. With aerosolization, aerosolized viral particulates are one of the primary sources of infections that they found when studying in experimental models and looking at transmission dynamics in terms of influenza and other viruses. And yes, SARS can be aerosolized, okay? Again, you get resource references. Again, New England Journal of Medicine. This is the reference from this article. So our results indicate the aerosol or fomite transmission of SARS-2 is plausible since the virus can maintain viable and infectious in aerosols for hours on surfaces up to days. So, well, it can go on surfaces, then you have to touch it, bring it to your nose, pick your teeth, whatever, you ingest it, now you can become infected. But if you're breathing in aerosols, and we're going to look at a study that evaluated the effectiveness of masks in preventing aerosols from being inhaled in an experimental model. All you have to do is you could literally be infected. Now they have like the higher number of viral particulates that you ingest or inhale. There's theories and models saying that would increase your risk of infection, and I would probably agree with that, because if you get thousands inhaled versus a few inhaled or one inhaled, yeah, you're going to have less risk of infection if you inhale less of them. So you could argue the potential for that, all right? But again, the evidence on a broad-based scale and the improper education and use of masks could actually be leading to more harm, all right? So they can be aerosolized. Do N95, which I have not seen anybody personally walking around with an N95 respirators, provide 90%, 5% protection. Do they? Okay, this is a question. Do they provide 95% protection level against airborne viruses? That would be, again, the aerosols, which we know that you could just breathe in. Adequate surgical masks. Okay, so they do not. N95 filtering face piece respirators may not provide the expected protection level against small virons. So you can go ahead and read that. So again, that was the experimental model. Infectious virus. And if we're concerned, this is one of the examples I'm going to give you. If the medical community was truly concerned, if the scientific community was truly concerned, if I believe it's Lamar Alexander in Tennessee, who I guess somebody told me, and I can't verify this, but I'm going to throw it out there anyways, and I might be wrong, so check me. All right? But I understand that he encouraged that we mandate influenza vaccines for as young as 6 months so we can tell the difference between coronavirus and influenza next season. But if you've received 2 consecutive flu vaccines, self-reported vaccination for the current season, all right, had an associated trend toward higher viral shedding in aerosol samples. And aerosolized virons were the most infective. In adjusted models, we observed a 6.3 times more aerosol shedding of viruses among cases with vaccination in the current and previous seasons. So if they wanted to use the available science that's available to us all and look at children's studies, adult studies, this is a study in a university, aerosolized virus is spread more, which is more infective than droplets. It's more spread through people who are vaccinated. So if they wanted to actually prevent people from getting sick with a virus that could be potentially deadly to an individual who is susceptible, then why aren't they paying attention to this type of research right here? Why aren't they telling people that if you're getting a vaccine on a regular basis, we have found, upon the research that's available to us, which this is the best science out there so far done, you are spreading more of the virus. And our children are more likely to get sick and be chronically sick with respiratory illnesses if they're the ones vaccinated when compared to unvaccinated children. All right? Aerosol transmission is important for influenza virus spread, but that is, again, influenza. Respiratory infection during SARS outbreak in Hong Kong in 2003. Already briefly mentioned this. But survey conducted in April and May of 2003 showed that most of the population wore the face mask in Hong Kong. But they also washed their hands more frequently. They used soap and washed their hands. They covered their mouths when sneezing and coughing. They used diluted bleach for the household cleaner. Another survey on healthcare-seeking behavioral traits conducted in June of 2003 showed greater than 70% of respondents practiced some of that hygienic measures more frequently during SARS outbreaks than during pre-SARS period. So, yes, being clean is good, all right? Going on, A Tale of Two Cities. This is the one I definitely did mention just a second ago. And I'm sorry, I got to shave my beard. I'm not wiping my nose because I've got a cold. I'm wiping my nose because I've got curly hair and my beard hair curls up in my nose occasionally and it gets really irritating. Sorry, man. I mean, come on, Ashley. You don't have a beard, so you don't know. This manly facial hair, you got to understand. It's not all. It's my wife says, it's rough. All right. A Tale of Two Cities, community psychobehavioral surveillance and related impact on outbreak control in Hong Kong versus Singapore. Let's look at it. All right. Hong Kong respondents had significantly higher anxiety than Singapore residents. The former group also reported more frequent headaches, difficulty breathing, dizziness, rhinorrhea, sinus problems, and sore throat. All right? There were fewer people, though, in Singapore that knew that fomites, aerosolized viruses, could be a source of transmission. So there's less education in Singapore about the virus. There were large differences between Hong Kong and Singapore in the adoption of personal protection measures in the population. Respondents with higher levels of anxiety, better knowledge about SARS, better knowledge? I don't know if it was better knowledge. It might have been the media blared it all over the place and got them fearful of it. They wore masks more often. They had greater risk of perceptions, were more likely to take comprehensive precautionary measures against the infection, as were older female and more educated individuals. So they did more to prevent the infection, supposedly. But let's look at the results of what actually happened in the real world setting. Despite having an outbreak in both areas, Hong Kong's mortality rate, case fatality rate, was 17. Singapore's case fatality rate was 13.9. And there was far less infections, far less deaths. Guess what? The country that didn't care as much and their people didn't take as many precautionary measures, they didn't have as many people dying. So it doesn't look like it really worked out. So let's take a look at coronavirus. Should we aim for herd immunity like Sweden? I believe we should have been, especially in the individuals who would be able to more than likely tolerate that infection. Getting an infection like chickenpox parties back in the day, they did measles parties, and there's very low mortality from those illnesses because when you have it in a controlled setting and you know you're taking care of your child, then you can get them infected and it's no big deal because their immune systems are adequately capable when supplied with the right nutrients and nutrition and low stress environments. We could actually help people prevent transmission. That is why studies have shown that those who contract natural infection with influenza, natural infection with whooping cough, and even now studies on natural infection versus vaccination with the HPV vaccine, they have lower rates of those infections and they don't spread the illness as often to other people, especially the whooping cough, because of the distortion in the immunological response because of vaccination. So number of coronavirus cases worldwide in July 1st, 2020. So take a look at Sweden. Sweden, far less cases. Now proportionally to the country, it's not that much different, but they didn't do what US did. US was the highest in the number of cases, all right? Number of novel coronavirus deaths worldwide by country. Now, US had the highest number of cases, but again, we have on, I forget the number of millions, 320 some million people or something like that. So if you look at the population of the US, it's far higher than Sweden, all right? And Sweden actually per million people had slightly higher mortality rate, but lower infection rate and lower number of people. But per million people who lived there, they had a slightly higher mortality rate. So I'm being honest with you folks, if you take a look at this data. So you could argue that, you know what, maybe what US did was good, but we had far more transmission. We freaked out way more. We didn't have substantial reductions in that. And Sweden's nearing to where they can go back to life as normal. And they didn't close everything down. They didn't have societal impacts. And here you're only looking at viral deaths. You're not looking at the increased suicides. You're not looking at the other things that cause people to lose their lives as a result of the measures taken by the US, which Sweden would not have experienced, considering the fact that they didn't totalitarian type response. Didn't have a totalitarian type response. So you have to take all of that information into a true, educated, informed decision on whether we did the right things or not, whether we could be doing the right things or not, whether we should be doing masks or not. World Health Organization lauds, basically, lockdown, ignoring Sweden's as a model for countries going forward. Don't do it, they say. But yet, they actually fared pretty dang good. Shocking, 2/3 of patients recently hospitalized in New York had been staying home. Oh, really? So again, if you're taking the measures to stay at home, you're more likely to wind up in the hospital. 66% of people who were home, it was shocking to them. More severe illness for those who are staying home. Well, maybe it's people who stay home are the ones that are more susceptible, and maybe, but yet they're taking the measures to socially distance the best, to use the protective gear the best, all these things, but yet they're the ones ending up in the hospital. I did a video about a 16-year-old boy who was the only one in his family who never left the house. And despite him being the one that was most socially isolated, he's the one that fell ill, possibly considering he had one negative test and one positive test of coronavirus. I did a video on that before. So check that out. TheWildDoc.com, you can get those. TWD in the comments if you want the resources that I'm mentioning here in this video. Cuomo doubles down on his orders, ordering nursing homes to admit coronavirus patients. The governor, who himself described nursing homes as a feeding frenzy for the deadly coronavirus, said that facilities can't challenge state regulations, forcing them to admit patients with the contagion. So when they forced people with the virus into nursing homes, more people died. What did they expect? So the reality is the number of people dying would probably be a whole lot less if we didn't have people like Cuomo forcing infected patients into nursing homes to start that, what he said would be a feeding frenzy. Nearly 90% of the U.S., and take this into consideration. So despite having a naval ship, hospital ship, in the harbor in New York, basically empty, 90% empty, but he forced people into nursing homes. Why didn't they put them on the ship? Huh? You have to ask, what was the objective? But don't worry, Cuomo says no one should be prosecuted for coronavirus deaths in New York, including those in a nursing home. So nobody should be prosecuted, including himself, I guess, right? Don't prosecute me, though I forced you to force people who are infected into susceptible populations, increasing the number of people dying. So a direct result of his orders, this man should go to jail for murder. He had a hospital ship. Do you get me? Our nation's leaders are not doing, all of them, some of them are doing better, some of them are doing far worse. I'd say North Dakota is probably doing one of the best. Check that state out. Or South Dakota, I believe it was. But listen to this. His orders cost people their lives. He doesn't want people to be able to be prosecuted if people die as a result of his orders. He had a hospital ship where he could have put infected patients, but he didn't utilize it. Instead, he forced infected people. Was he trying to kill people? That's what it would appear to anybody with common sense, in my opinion. Epidemiology, this is one of the studies gone through. Face masks to prevent transmission of influenza virus. This is influenza, this is not SARS, but it is a virus and we can take and get a little bit of information from it. May not be fully applicable to different types of virus. Just remember that. There are fewer data to support the use of masks and respirators to prevent becoming infected. In conclusion, there remains a substantial gap in the scientific literature on the effectiveness of face masks to reduce transmission of influenza virus infection. While there is some experimental evidence that masks should be able to reduce infectiousness under a controlled condition, controlled meaning proper use, all those things. Disposable masks would be a big one. There is less evidence on whether this translates in effectiveness in natural settings. There is little evidence to support the effectiveness of face masks to reduce the risk of infection. The use of masks and respirators to prevent transmission of influenza. Systemic review of scientific evidence. This study right here probably has the most amount of evidence in regards to wearing face masks in a hospital setting. Hospital setting when hospital workers were working with infected patients. They did say, again, very not so well done studies, but they showed some statistical significant reductions in infections in those who wore, they didn't put the face mask on the patient, they wore the protective gear. But remember, they weren't reusing all of that equipment. They weren't bringing it home, hanging it, and putting it on the dresser. They weren't throwing it on their bed. They weren't throwing it on their tabletop. They weren't hanging it from their car, rear view mirror. They didn't do that. They, in fact, had ventilation systems to help pump out the virus in the air. So in that controlled setting, you would expect helping to prevent droplets, which that's what masks and N95 respirators can do, but they can't prevent aerosolization. But again, in these hospitals, better ventilation in those areas of ICU in pneumonia and severe, like SARS, again, this is SARS-1, not SARS-2, they took the proper precautions. And that can be beneficial. But again, that's a hospital setting. That's not everybody in the United States and world. Effectiveness, precautions, and droplets contact. Again, this is one of the studies they went through. And they showed fewer staff who wore the masks and gowns and washed their hands became infected compared to those who didn't. But stepwise logistic regression was significant only for the mask. So mask would have been maybe the way in which it was best. Again, because your hands, your body, your clothing, different things like that. But again, they would take their clothing home and they'd wash it right away because they were working with some of the, what would be considered at that time, SARS-1, one of the most deadly viruses. That's what it was considered. So they took much more precautions. Practice the droplet precaution and contact precaution is adequate in significantly reducing the risk of infection after exposure to patients with SARS. The protective role of masks suggests that in hospitals, infection is transmitted by droplets because, again, in hospitals, they have ventilation systems to help reduce aerosolization, filter out and renew the air so you don't sit there and dwell within the building or room with an infected person who's aerosolizing the virus. So then droplet protection, which masks provide, would be beneficial. So that said, if you're working with somebody, yeah, wear a mask. If you're working with somebody who's infected. Effectiveness of N95 respirators versus surgical masks, there was no difference and no benefit shown. Effectiveness of masks and respirators against respiratory infections in healthcare workers, a systematic review and meta-analysis, again, no benefit shown. N95 respirators, hang on a second, make sure this isn't the one that I wanted to go through in, because I've got a couple that I'm going to go through in more detail. Yeah, so that one actually has some information we'll talk about in regards to SARS, that study right there. So we'll go through that in a minute. N95 respirators versus medical masks. Again, you can't say either one is not effective if you're just comparing mask to mask, preventing influenza, but there was no difference in there. All right, you would think though with a better respirator, you would get better protection than with a mask, but you didn't. So either it means the N95 doesn't work, or it means the mask works just as effective, or they both don't work. That's not been proven, especially in population-based settings. Effectiveness of N95 respirator versus surgical mask against influenza systematic review. Use of surgical face masks, and none of these are finding effectiveness in terms of versus the different types of masks. Use of surgical masks to reduce the incidence of common cold in healthcare workers. It did not reduce the common cold, which coronaviruses are in the classification of common cold viruses. So the masks, so this would give us evidence and information to say that surgical masks don't prevent it. And that's what they're telling people to wear. And that's what they're trying to mandate people wear. But yet, it doesn't prevent a virus, which the coronavirus is a common cold virus. It doesn't prevent that. Face mask use in healthcare workers has not been demonstrated to provide benefit in terms of common cold symptoms or getting cold. Again, the science is all over the place. It doesn't show one way or the other clearly. If I was working directly with somebody who is severely infected, it might be a good idea to do your best. The cluster randomized trial of cloth masks compared with medical masks in healthcare workers. That's a really good one, and I'll go through that in a minute because that is the one a lot of people are utilizing to say that cloth masks are harmful, which the evidence did lead us to show and say that that is likely the case. Again, because of improper use especially, all right? High humidity leads to, this is how we could help people. This is what I'm doing in my office. High humidity leads to loss of infectious influenza virus from simulated coughs. All right, we still good on time?
Yeah, you got about 5 minutes.
5 minutes till 1:30? Or what time? Wow.
It's a little bit, yeah, it's 9 minutes, but they'll probably be here.
Yeah. Is it in office? Okay. So I got a few more minutes before I've got to jump off here. High humidity leads to loss of infectious influenza virus from simulated coughs. All right? So you can lower with aerosolization. If you have higher humidity, the humidity actually kind of contacts the virus and that allows for the particulates to fall to the earth faster, thus reducing the breathing in of aerosolized virus. This is something that could be utilized in all settings to help improve or reduce viral transmission. Again, this is influenza. All right, maintaining indoor relative humidity at greater than 40% will significantly reduce the infectivity of aerosolized virus. This is something that people could do. And it'd be far less. Hey, listen, people are like, no, I don't want to walk into somewhere if they force me to breathe in air that's higher humidity. Well, if you don't want to breathe it, that's fine. But again, these are ways we could be helping people. Now, again, one of my biggest issues, fever reducing meds encourage spread of flu. So why hasn't, and when you look at this, thousands additional deaths and cases are caused by people using fever reducers. So what I want to ask and say is if the medical community and the scientific community and the government agencies truly cared, there has not been a single study that shows reducing a fever is beneficial for the individual who has the illness, an infection. Animal studies and human studies both have shown an increase in death rate in those reducing the fever, no matter what the means, even if it's shaving the hair off of a ferret, even if it's using a cold rag, even if it's cooling the body with ice or whatever it may be. Cooling the body down, if the person is fighting an infection, weakens their ability to mount a proper immune response. And understanding that, you could understand why there's a higher survival rate in individuals and children and adults and the elderly who mount a higher fever. Those who have a higher fever actually have a higher chance of survival from infection. So, but in terms of using fever reducers, which if you're sick and you have an infection, you should be staying home for your own safety, not wearing yourself out, going to work. We need to provide a situation and employment and opportunities for people to stay home when they're sick. For parents with children who are sick, they should stay home. It's a good idea. And if you look at viral transmission, utilizing a mask and putting it on the person and in the homes of people who are infected, when in an environment of infected people, it may be beneficial. They've shown that in a couple studies, which had hit and miss results again. But again, if they cared, why don't they discontinue the use of all fever-reducing medications if people can lower their fever, artificially feel better, go to work and spread illness, go to school and spread illness? If they cared about reducing illness spread, they should have used this study back in 2014 and shut down and stopped. They should have used the studies years prior that all showed anytime a doctor provides a fever-reducing or suggests a fever-reducing medication, that they're increasing the risk of somebody dying. Thus, thousands of people have died. Likely millions of people worldwide have died as a result of doctors' recommended drugs. If they cared, if the system truly cared, if those who know about this truly cared, they would get this information out to the masses so that we could effectively reduce the transmission of viruses and infections and help the individual who is infected survive. Why aren't they doing that? I'll go through that later. But these are the studies. Effectiveness of masks and respirators, N95 respirators. Okay, compared to masks, N95 respirators confer superior protection against laboratory-confirmed bacterial infections, but not viral infections. Existing evidence is sparse and findings are inconsistent within and across the studies when it comes to these viruses. All right, they assumed baseline risks of SARS infection to be between 20 and 60%, estimated from the available cohort. So when they give you results like what they say in the study is an 80% reduction in SARS infection rates, they did that off of assumptions of infections. So if they don't have randomized controlled trials, they're going off of assumptions. All right? I want concrete evidence, and there's a lot of information out there in the scientific community and medical community that shows that if we were testing people's immune responses, their immune response capability, if we were making sure that they're adequately nourished, if we were making sure that they weren't in a fearful state or high anxiety state, then guess what? we could reduce the death rate from infections. But we haven't implemented that stuff. They haven't cared to do that stuff, it seems, at least within the mainstream medical system. Alternative medicine is doing things like that. That's why the Wellness Way doctors like myself have implemented these strategies with our patients, helping to make sure that their nutrition hopefully is on point, making sure that they're getting adjustments which improve mucosal membrane immune responses, thus being capable of neutralizing and blocking a virus from getting to your mucosal surfaces and then becoming infective in your body. So, no protective effects. Again, SARS was reported for disposable cotton or paper masks. No protection. So I have to go. I believe my patient is here. You guys can get all of this information. The only other thing that I wanted to mention very briefly is this. The conclusions. This study is the first randomized controlled trial, cloth masks, and the results caution against the use of cloth masks. Awesome. Be right there with you. Cloth masks. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. Cloth masks should not be recommended for healthcare workers, particularly in high-risk situations, and guidelines need to be updated. So again, cloth masks increase the risk of infection. And what do you see most people wearing out there? Cloth masks. With the evidence available, why aren't people being warned about this risk? Increased risk of infection. Thank you very much. I'm the Wild Doc. Please share the truth. Don't just like it. It's the only way we save lives. Love y'all.